Today, we'll be sharing information on what advocacy is, what the Alzheimer Society of BC is doing to advocate, how you can get involved in advocacy, particularly as we lead into the provincial election. And then we will go into a panel presentation with our excellent panel today. So, what is advocacy? Advocacy is really any action you take to create change. And I think of advocacy as including self-advocacy and grassroots or systems advocacy. Self-advocacy are the actions you take to improve a situation for either yourself or somebody you're supporting. While grassroots or system advocacy are people who are acting in a united way to create change. So they're influencing decision makers, for example. And the way that I kind of frame this is that the golden rule to figure out if something is self-advocacy or grassroots or systems advocacy is if I get the desired result, the result that I'm striving for, does it affect just one person or does it affect a whole group of people? And both are important, both play a different role. And today we're going to be focusing on the systems advocacy piece. So we have a advocacy team at the Alzheimer Society of BC who's engaged in advocacy in a number of different ways. One of the ways that we are involved in this area is by responding to policy that comes out, new bills, for example, new reports, analyzing them and thinking about, well, what's the impact on people living with dementia here? Sometimes we'll issue written responses, which you can find on your website, for example. The other thing we do is we regularly meet with MLAs in order to ensure that they are aware of the work we're doing and aware of how dementia is affecting their constituents. We have an annual legislature luncheon where we invite all of the members of the legislature to join us for lunch and learn a little bit about the Alzheimer Society of BC and meet some of the amazing lived experience partners that we work with. For those of you who don't know, and I'm assuming that most of you will, but in case not, I will say that a MLA stands for members of Legislative Assembly, and they represent a given constituency, so a given area. So you'll all have an MLA. And if you're not sure who that MLA is, you can find out by going to the legislature's website and using the Find My MLA tool. The Alzheimer Society of BC is also involved in advocacy education. So whether that's self or system advocacy, like the session that we're holding today, we help people learn about the advocacy tools that are available to them. We also hold community events such as the community dialogues that we've held this year in different communities in the province. And probably why you're all here, we are also involved in developing campaign messaging ahead of the provincial election. And so every time we go into a provincial election, we have an awesome opportunity to reiterate messaging that we hope that the various parties will include in their campaign platforms. And so we, the Alzheimer Society of BC, have one voice, but our voice is stronger together. The more that we are able to reiterate shared messaging and ask the government for similar things and political candidates for similar things, the more likely it is to land in their campaign platform ahead of the election, which is essentially the promises that they're making to the public if they are to get elected. So that's what we're doing now, and we can talk about some of the ways that you can get involved. So as I mentioned, there's really a large range of things you can do depending on how comfortable you are with advocacy. One of the things that you can do, and you can do it at absolutely any time, it doesn't need to be tied to the provincial election, is you can talk to your friends, your families, your coworkers, and your neighbors about the challenges facing people living with dementia. By sharing your stories, you help reduce the stigma and create awareness about what is needed. The next thing that you can do is you can write an email or letters to the candidates in your riding. And this gives you an opportunity to share your personal story and ask the government or the candidates in your riding what actions they're planning to take to address some of your concerns. So we have a resource called a simple guide to raising your voice, and we can put that in the chat pod, which gives you some tips on how to do this. Early in June, we will also be releasing our campaign in full. So you'll get access to a new website that we've developed, which houses a number of tools that you can use to support your advocacy in the lead up to the October election, including a letter writing tool. And so that letter writing tool will make it easy for you to determine what candidates are in your writing and to send a letter which you can edit and alter to sort of make your own and share your own voice. You can also request a request a meeting with your MLA. This is a good opportunity to share your experience of dementia and ask for specific things. And your specific ask will vary depending on what you are facing at that particular time. But it's really, these meetings are an opportunity for you to tell your story, ask questions, and really encourage them to consider how dementia is affecting their constituency. We do have some tips in that guide about how you might do that. There are a few pointers that we would share, and our panelists are going to talk about that a little bit more in a moment here. And you can use social media to share your experiences. You can retweet the Alzheimer Society of B.C.'s posts on Facebook or LinkedIn, for example. You can also share your own issues or stories of impacts. We always encourage folks to use hashtags in those posts to help you increase your reach, and to tag the person who your post is directed at. So you may tag the minister, for example, you may tag your MLA, you may tag the candidates that are running in your area once those candidates are announced, which they may not likely be yet in your particular area. So more and more political candidates are looking to social media to know what is affecting their constituents. And you can join us at the IG Wealth Management Walk for Alzheimer's, which is taking place not this Sunday, but next Sunday. We often get a good turnout from MLAs and other dignitaries at these events. So this can be an opportunity for you to chat with people in attendance about how dementia is affecting you and how it's affecting your neighbors, your family, and your friends. Okay, so I'm going to give you a little bit of a sneak peek here in terms of our call to action, what we'll be asking for in lead up to the 2024 election. And we will be releasing our entire campaign and the 3 policy priority areas when we get into the beginning of June. And so you will receive an email letting you know that we've gone live with that. And once you do, I really encourage you to check it out and use the tools and let us know what you think. We are asking for action in 3 key areas. We are asking all parties to commit to helping to break down stigma and social isolation, to improving the diagnosis experience, and to ensuring the right care is available at the right time. When we talk about that first pillar there, we are asking candidates to fund and promote a province-wide awareness campaign to bring attention to dementia and to ultimately reduce the stigma being faced by people in communities across BC. The second thing we are doing is we are asking for an increase in funding for dementia-friendly community initiatives through the Age Friendly BC program. When we talk about improving the diagnosis experience, we know that it can be very difficult for people to get a diagnosis. And once they get them, they often feel like they don't have clarity about what happens next or what supports are available to them. And so we are asking for candidates to commit to establishing a clear dementia pathway similar to the one that is currently in place for cancer. We are also asking for all parties to incentivize physicians and geriatricians to specialize in the care of older adults. We know that we're already facing a shortage in this area, and it's situated to get a lot worse as the population ages and needs increase. And finally, we're asking for a commitment of $4.2 million annually to help us meet the growing demand for trusted first-link dementia support programs and services, something that many of you probably have personal experience with. And finally, our last pillar is ensuring that the right care is available at the right time. We know that people living with dementia fall through the cracks, and we know that as the population ages, we're going to see more pressure on our system of care unless things are addressed. So we are asking all candidates and all parties to commit to eliminating the copay for home support services, to increasing access to adult day programs, to increasing long-term care spaces, and to reviewing the assisted living system to identify gaps. So again, that's a little bit of a sneak peek into our overall campaign, which we will be releasing publicly at the beginning of June. So right around the corner here, and we hope you are as excited about it as we are. We've already outlined many of the ways that you can get involved in advocacy activities that the Society is participating in. In terms of the election specifically, you can also speak to those who are canvassing. So when people are coming by and knocking on your door, it's a great opportunity to ask them, hey, where does your party stand on dementia issues? What are you planning to do in terms of increasing long-term care beds, for example? You can use social media. You can write to your candidates. And again, the tool that we are launching shortly will make it very easy for you to do that. You can attend all candidate events and ask a question about dementia. You can meet with the candidates in your riding. They're often very keen to meet and to hear the issues facing the people that they're looking to represent. And of course, you can vote depending on dementia issues. So again, we will be releasing more information at the beginning of next month, so do stay tuned. Today, I have the absolute pleasure of being here with a fantastic panel, including Terry Lake. Terry Lake is the CEO of the BC Care Providers Association, which represents the majority of long-term care operators in British Columbia. Terry is a recovering politician. He served as the councillor and then the mayor of the city of Kamloops, and then was elected as a member of the legislature for the riding of Kamloops North Thompson in 2009. He served as the Minister of Health from 2013 to 2017. And he is also my former boss, and today is his birthday. So welcome, Terry. Happy birthday, and thank you for being here. Next, we have Jana Schultz. Jana is a registered social worker residing in the traditional unceded territories of the Ktunaxa peoples in Cranbrook, BC. She is a passionate advocate for change, and she believes in using her voice to stand up for others, which is something that I think she does very well. Jana's father was diagnosed with dementia in 2016, and alongside her mother, Jana was providing care for her father. Jana's mother recently passed away after a brief battle from cancer. We're sorry to hear that, Jana. Jana uses her experience to advocate for more targeted research, culturally safe resources and supports, equitable access to care, and increased quality of life for those impacted by dementia, particularly for Indigenous people. So welcome, Jana. Thank you. And last but not least, we have Mario Gregorio. I've known Mario for more than a decade now, and during that time, he has advocated passionately to create awareness, reduce stigma, and educate the public about dementia. He's a member of several committees where he brings the lived experience perspective and where he encourages inclusivity and accessibility for people with hidden disabilities. He's a recognized speaker and he's involved with many community projects to help alleviate loneliness and foster social connection. So welcome everybody. We'll turn on your cameras now and we will dig into our questions. Okay, so Jenna, I'm going to start with you. What are some common misconceptions about being an advocate which you would like to myth bust?
Thanks, Rebecca, and thanks for having me here, and happy birthday, Terry. So Rebecca, actually, you covered a lot of the misconceptions that I was going to speak about. So I'll just kind of when you were doing the PowerPoint slides there. But a common misconception about being an advocate is that you have to do it big in order to do well. And that's not true at all. In reality, advocacy comes in many forms, such as you had mentioned, sharing a post on social media. It could be talking with a candidate as they canvass before the election. Getting involved with organizations such as the Alzheimer Society, and meeting with policymakers. So it has a wide range, and there's no advocacy that is too small. Another misconception that people tend to think is that their stories don't create change. And, even from my experience, is that that's the foundation of change, is that grassroots, that experience. Just to give you an example, is I started going into my MLA's office about a year ago after the legislature, the luncheon there, and just talking about presenting a dementia strategy for the province of BC. And it's led to so many different things, such as, in my professional life, getting referrals from that office of people who are struggling. So, it's building that relationship, and change doesn't happen overnight, but we can create ripples just by sharing our stories. Those with lived experience often make the best advocates because they know what worked, what didn't work, and where we need to go from here. In addition, sharing stories can help someone else that is experiencing similar situations not feel so alone. So I just want to end this question off with a quote from an American activist, Alice Wong. She states, advocacy is not just a task for charismatic individuals or high-profile community organizations. Advocacy is for all of us. Advocacy is a way of life. It is a natural response to the injustices and inequality, that's a hard one to say, in the world. Thank you.
Thank you. Thank you very much, Jana. I think you bring up an excellent point that storytelling is really one of the most powerful tools that we have as advocates. And Carrie, I'm sure that you would agree that even, so many years after being the Minister of Health, there are probably some stories that still really resonate with you.
Absolutely. Jana's absolutely correct. It is the stories. And, we're a storytelling species, and that's how we create empathy. We can walk in each other's shoes on the basis of stories. So I want to just refer to a podcast that I particularly like as a storytelling tool. And for those of you familiar with CBC radio and television, Gavin Crawford is a comedian that hosts a show called About News, which is kind of a funny game show based on the news stories of the day. Gavin was also on 22 Minutes a while back. But Gavin, who's actually speaking at our conference coming up in Whistler in a couple of weeks, created a podcast called Let's Not Be Kidding. And it's about his mom who suffered from dementia. And, when you hear those stories told in a way that makes you laugh one minute and cry the next, you can almost feel what it's like, in that moment for that person. And he has other artists like Jan Arden, whose mom suffered from dementia, come on the podcast. So I think sharing those stories and hearing those, first of all, and then passing on information like that, like for any MLA or anyone you're talking to about dementia and Alzheimer's, to give them information where they can hear those stories, your stories or stories told by a professional storyteller like Gavin Crawford are really, really handy. And I remember in my office as an MLA, you meet with constituents all the time, and you have constituents that come in and they have a kind of a sort of, I don't want to say stern approach, but there's an approach there where they're almost demanding something, and not really approaching the interaction as development of a relationship. And in order to help someone envision what you are dealing with and what you'd like to see done, you have to create that positive relationship. And so, I had a lot of those positive relationships with organizations and individuals when I was an MLA. The Alzheimer Society was one, and one of my constituents is now sitting as a director on the board of Alzheimer's because, of the interest, of course, as his wife had Alzheimer's, and he became such a strong advocate. But he developed that relationship with both of the MLAs in our region, and that led to some very real actions. As Minister of Health at the time, I was a champion of making sure that First Link was funded to a greater extent at the time. So telling those stories is hugely important. Creating the relationships. I had really good relationships with a number of other organizations like the Food Bank, like the Brain Injury Association. And so when you develop those positive relationships, you as an elected official want to carry their message forward and try to either create public policy or create funding opportunities that support them. But it's always, we're humans, right? It's a relationship that you create that's going to pay off for you.
That's something we often say, approach the person that you're connecting with as an ally rather than an adversary. And that can be hard. That can be hard when we're grieving, we're navigating caregiving. You're dealing with some really complex and difficult things and a lot of emotions. But yeah, by building that relationship and going from that place of trust and connection, I think that's where people can really be impactful. Mario, what has been helpful for you in terms of getting the attention of somebody who you may be lobbying?
Thank you very much, and for inviting me to be part of this panel. Rebecca, you mentioned something that resonates with me. Is at this time, which is an election year, it is very important to talk and ask questions to those canvassers, because they're the ones who take notes and deliver those notes. What are the people asking? What are the people's concern at this time? So what can we do to improve the lives of people affected with certain diseases, specifically dementia? It is very important for them to understand and make note that, hey, this is what the public is asking. We need to make sure that we address these issues. And it's very important for them to understand this. As a person who was diagnosed with vascular cognitive impairment or dementia 15 years ago, I like to think that I'm still doing well. But because of the stigma associated with dementia, people are very reluctant to talk about their diagnosis. There's some multi-ethnic barriers that people have to deal with in terms of, do I disclose to my neighbors? Do I disclose to my friends? And all those kind of things. So I'm very fortunate enough to be invited to student forums and some other ethnic organizations. And the message that I want to tell them usually is, it is okay to talk about dementia because it is a disease. It is not our fault. It's just like any other illnesses wherein there's really no shame about having this illness. It is not an act of God or anything that some people may have misconceptions. It is very important to tell people, hey, it is okay to talk about dementia. And it is very important also as part of my advocacy to talk to students and tell them that it is the patient-oriented reviews. What do we need? What do we want in our own language? I think that is even very important because most of the time, some people will talk about dementia in such academic, demeaning language that it is very important to understand that we need to look at it from the perspective of the people living with dementia. Thank you.
Thank you, Mario. You touch on a number of important points, and like what you say about, asking questions of the people who are coming to your door canvassing. And so, Terry, I'm interested if you sort of put your pre-election hat on and you're thinking back to what it was like to participate in all of those campaigns. What role does advocacy play in the lead up to an election, thinking from the perspective of an elect hopeful?
Yeah, it's a good question, Rebecca. And, we have an election coming up October 19th. So you think, well, that's a long time from now, but it's really not. And all of the parties and potential candidates are right now thinking about what is going to make the difference to swing voters my way. And some, of course, will be well versed in the issues. Others may not really know what the key issues of the day are. So it's really important to get to potential candidates as early as possible, because when they meet with the rest of their group that are trying to get elected for a particular party, they will discuss, as you mentioned, what are you hearing at the door? What are things that are people concerned about? And they may have a bit of a framework for their election platform kind of set already, but it won't be complete. And so you can provide valuable input into what those election campaigns are. And I will say that you may find that people don't see the things that you think are important as important for them, because that's maybe just not their experience, or what they're seeing are things like the cost of living, housing, the sort of economic issues tend to dominate the news. The fact that there's a crisis of caregivers going on at the moment sometimes flies under the radar and doesn't get the same amount of coverage. And so they may not think that these are important issues or as important as those economic ones. So that's where you need to educate them and let them know what your caregiving experience is like, what others have told you, and then perhaps even try to relate it to those other economic conditions. For instance, caregivers take a lot of time out of work, right? That reduces productivity. And so it's not just an issue that impacts the individual caregiver, it impacts society and the economic good of society. And by the way, as we all know, most of those caregivers are women. And so, women have multiple barriers in terms of the workplace and having the same level of opportunities. This is just another one that they have to overcome. So in terms of equity, fairness, we need to do more to support caregivers. And so that's a very powerful argument that has both an emotional component to it and an economic component as well.
Thanks, Terry. Some great framing. Okay, so I've got a question for you, Jana and Mario. How do you go about preparing for a meeting with an MLA or a political candidate that's running in your riding?
Uh, uh, if I can answer first, Jenna, if you don't mind. Summertime, springtime is perfect occasion for us to meet our MLAs. They usually have this spring getting to know you, or summertime there is barbecue. I know I have already committed to some politicians barbecue sessions here in Edmonds, in Burnaby, and during these sessions I meet 5 of our MLAs. So it's always nice to shake hands and remind them about hidden disabilities, people who are underserved, especially those who may have missed their radar. And it's always nice to remind them about the concerns of older adults in the community. What are their needs? How do we make it dementia friendly? And also remind them about Alzheimer Society's Dementia Friends community initiatives. And it's always nice to tell them, how can I help? Call me, and then maybe we can chat about some others. If you have subcommittees that involve people, count me in. And I'm not afraid to tell to sort of say, neither is, hey, count me in, and let them know that you are available and you are a source of information that may be helpful for them when they create policies that involve older adults. Thank you.
Yeah, it's a great point, Amerio, and a good reminder that if you aren't on your local MLA's mailing list, that may be something you want to think about doing as an advocate, so you're aware of the events happening in your area. Jana.
Thanks, Mario. So some of the things that I've done that I've found to be successful is, knowing what my priorities are. So what has impacted me the most? Because if I can speak from that lived experience, then I'm going to speak more passionately, right? And I'm also standing in my truth. What are my experiences? How did it make me feel? Working in the healthcare system, I know it's not perfect, and yes, our family has fallen through the cracks. Um, so what are those priorities? I always write notes. And I always go to the table in any form of advocacy with solutions. I think about what are some of those solutions that I think would help. Of course, they're not going to help my mom or my dad, but I hope that, my advocacy at least leaves a legacy for other people who experience challenges with dementia. But I found I get a better response when I go with solutions, and they might not be used, but I'm going there, bringing up ideas that maybe those policymakers or the MLAs didn't think about. And, quite often I'll even go, and not everybody, does this, but I'll go with research. I go armed with research to say, I'm not alone. The landmark study, The Many Faces of Dementia, was just released, and my MLA's office was one of the first stops to drop that off, because it does show that increase, right? And the fact that we need to have more supports in all areas. And again, when Terry was talking about housing and the economic, barriers and women caregivers, that's not going away. That's just going to increase. And so it's kind of a multi-pronged approach that I take in order to ensure that I'm hitting my priorities. Yeah.
Yeah, I love what you're saying about coming with solutions. And I think it really demonstrates what we were speaking to before about building relationship and allyship, and saying, here, I'm here to support you. I want to do what I can to ensure that this is a priority that gets put forward. And here's the research to make it easy for you. I think that that's an excellent strategy. The other thing that I would maybe just add to that for folks who are listening today is that it can also be really helpful to ensure that you're setting up an appointment in advance. Some MLAs will be okay with you dropping into their offices. You're not always going to catch them because they have busy schedules. So setting up an appointment in advance can be really helpful. And then ensuring that you are prepared, as Jana says, and that you are sticking to your allotted time. I know that goes a long way, just given how complex MLA schedules can be. Terry, I see that you're taking your mute off there. I think you probably have some lived experience to share.
Yeah, it's a really good point. And your friend in the MLA's office is the constituency assistant. That person that is books the time for the MLA and reads a lot of the emails before sending them on to the MLA. So develop a relationship with that person. I had tremendous constituency assistants, and they could solve individual sort of issues along the way, but in terms of sort of bigger political policy issues, they would develop relationships with people, and then the MLA depends on them to kind of do a little bit of screening for them, because you only have so much time in your day. So really develop that relationship. The MLA is, they're just like anybody else, right? They're nothing special. happen to run for office and get in, but while their workload may be fairly high at times, especially if your MLA is a minister, for instance, they have a fairly high level of workload and stress. So you really need to optimize your time. But don't be intimidated. And I found that even when I was a city councilor and meeting with an MLA or a minister, I felt a little intimidated. So there's always that kind of nervousness, if you like, but once you develop a relationship, that goes away, and really try to do that. It's really helpful. Organize your thoughts, do a little bit of research on the person, whether it's a candidate or an MLA, like what's their background? Maybe they've got some related experience that you can say, hey, I know you've been in this field, or you have that experience. And again, it's part of developing that relationship. Just doing a little bit of homework. And Janice said, come with solutions. And that's so true. Like if your MLA thinks that emergency department waits are the biggest problem in healthcare, well, let's face it, if you've got seniors that are being sent to hospital because they can't be cared for properly at home, or there's not enough long-term care spaces, that clogs up the whole system, including the emergency department. So, that's a way you can relate your policy concern to their policy concern. So just think about how you can relate your issue with their highest issue, and how what you're talking about can actually provide a solution for what they're worried about.
Excellent point.
Rebecca,
Yes,
can
Maria.
I just answer one of the questions that popped in before I forget?
Please.
How do we get involved when there are very few political events? What I do is I always make a point to invite them on activities that I may be involved with. For example, I'm involved as a volunteer for a homeless shelter, and we have Appreciation Day. So I make a point to invite some of the MLAs, come visit us and let us show you what we're doing for the people with mental capacity challenges. Oh, by the way, Terry, your tip about developing relationships with constituency assistant, that's excellent, because I find that really visiting the constituency office without seeing the MLAs, you develop that kind of relationships, and before you know it, you are on name basis, and whenever you see them in certain functions, you just remind them. Of course, they have met so many people, you just give them a brief reminder about issues like dementia, and sure enough, most of them will that will click in their memory, kind of thing. Just a friendly relationship, I think, will go a long way. Thank you.
Thank you, Mario. And I can just add to that, Lori, it can also be helpful to write a letter. And again, we're going to be releasing some of our tools early in June, which has a letter writing tool, which makes that easy to do. Also makes it easy to post social media messaging that you can customize with your own stories or perspectives. While we'll provide templated information, which includes the society's kind of key priorities leading into the election, what we really encourage you to do is add your individual story and perspective to those letters. If a politician gets a letter that's quite clearly a form letter, that might matter. That probably doesn't come quite up on their radar as much as somebody who's sharing their personal story, for all of the reasons that we've already talked about today. Writing a letter to the editor is another thing that you can do in terms of advocacy. And for you folks who may be living in rural or remote communities and may not be close to a constituency office where you can meet with somebody, and MLAs and candidates, just like the rest of us, are spending more time on Zoom and Teams and may be willing to meet with you in that capacity. And as we get closer to the election, there'll be sort of more and more of these meet and greet opportunities coming up, because people do want to get their name and their face out there.
And Rebecca, as candidates surface in your region, reach out to them. Someone will announce they're going to run for a certain party. Maybe they don't have the nomination yet, but they're on your radar. So reach out to them and say, hey, can we go for coffee and talk about this? And then, of course, there's all candidates forums when we get into the election period itself. And don't be afraid to go and ask from the audience questions about care and support for people living with dementias.
Thanks, Barry. And so I see a question in the chat pod here. What has been the biggest surprise to you while you've been a dementia advocate? So maybe Jana, we can start with you.
Sure. I think in particular, well, there's been a couple things, but the biggest one, I guess I will use our local MLA as an example. Because I've heard all different things about, them being people and not, that intimidation and stuff. It's just after my mom passed away, I went in there to kind of do a review of the advocacy I've been doing. And as soon as I saw him, I started crying. And, just kind of that human to human relationship, it was like, oh my gosh, what can I do for you? And I think that was the biggest surprise, is that we had developed a relationship where I felt safe enough to let down my guard and to just cry in that space, and then talk about the reasons for the tears, such as, my mom passing away, dedicating her life as a caregiver, caring for my dad, becoming, all those different things that I guess that I was kind of suppressing for quite a long time before I went back. And, we sat down like we were sitting at a kitchen table having coffee. And to me, that was one of the biggest surprises. Just to add on to that, I think too, is things like this webinar is, once I started sharing my story, having the support of the Alzheimer Society of B.C. and just having people there to say, hey, your voice matters. I mean, I always knew it mattered, but to have it amplified by an organization that is so passionate about creating change for those living with dementia or those impacted by dementia has been a huge surprise. And it hit me at the right time when I needed it. So my heart goes out to everyone who advocates for dementia, and to all those who are dedicated, like the staff at the Alzheimer Society.
And thank you for everything you do, Jana. It's, we have one voice at the Alzheimer Society of BC, and it might feel like a big voice, but it matters so much more when it's sort of mobilized at that local level, and MLAs and candidates are really able to see, hey, this matters to people in my community that I am either representing or looking to represent. I have a story from Marilyn Furlan here in the chat that speaks to an interaction that she had with Minister Dix, and just how her comments really resonated with him, and how she's just reiterating what she's hearing from the panel, that all MLAs and folks engaged in different political parties are human. She's also suggesting that it's helpful to use social media to share stories, and she says, happy birthday, Terry. And so I have a question in the chat pod here that says, for Terry, are letters actually read by MLAs given their busy schedules? How do you have the most impact possible with letter writing?
Yeah, it really depends. I think Jana's comment about personalizing it, or maybe that was you, Freddie, that said that. But you really have to make it personal. If it's just a form letter, you get a lot of those, obviously, and once you've read the first paragraph, you know what it's about. But a personal letter. When I tell the story of my friend Richard, who was diagnosed with early onset Alzheimer's, I feel the emotion, and I know whoever I'm telling it feels the emotion. And so, you can put that down in a personalized letter and let them know your experience and the impact it had on you. And in some, if for instance, First Link was part of that story, let them know how important that program is. Let them know how important the support that they got from Alzheimer Society has been for them. They need to know that, because it's not just about maybe implementing new things, it's about supporting the things that are already there or continuing to support them. So I think there's a lot of demands on people's time. And that's why, again, and I'm glad Mario has verified his experience with the constituency assistant, because if Kirsty told me, Terry, you need to pay attention to this, I paid attention to that. So, really it's like, you want to get to me, you get to my constituency assistant in my former working life. You want to get to me in my personal life, you talk to my wife, and I'm going to pay attention.
Thanks, Terry. And so just to sort of build on that, when an MLA is meeting with a constituent, or when you're a candidate who's meeting with a potential constituent, what are kind of the things that you're thinking about? What's going on in the back of your mind?
Depends if it's close to lunch or not, Rebecca.
Keep you fed, keep you happy.
Yeah. Well, you're really trying to understand what the motivation is for the person, and the range of issues are quite varied. And so, if it's something you haven't encountered before, you're trying to figure out where it fits into the work you do. It may be something. Some people don't understand the different levels of government and who has jurisdiction over which level. So you're trying to kind of decipher all of that in some cases. But when someone brings their personal story and is authentic, that's all you're thinking about is that person and what they're going through. You really can devote your time and thoughts to that person if it's personalized in that way. So, yeah, there may be times when you're really rushed and trying to get, through a whole bunch of meetings in a day or a whole bunch of different things on your to-do list. And I think if that happens to you when you see your MLA, don't necessarily be put off. All of us have days where we're not perhaps the person we want to be all the time. So you can say, well, look, I've taken some of your time today and appreciate that. Can I ask for a follow-up meeting in a couple of weeks? And that gives the person an opportunity to kind of go away and think about it. Maybe they talk to other MLAs or their ministry officials and can come back. And the next time you talk to them, it'll be a different encounter. So don't be afraid to to just kind of lay the groundwork in that first meeting and then follow up later. That's sometimes a very good strategy.
Thanks, Terry. And when you're sort of thinking about social media and kind of putting on your candidate hat, which I've been told you won't be doing again, but putting on your candidate hat and looking at sort of the places you've been tagged, what lands and what doesn't?
Well, swear words don't work.
Good reminder for us all.
Yeah, I again, it's being respectful, I think. Today we're so polarized in our politics. If I see someone attacking, if I saw someone that was attacking me before, you're not going to pay attention to that, or at least hopefully not so much. But if someone is, sincerely asking you to pay attention to something without being demanding, or, they're just in good faith wanting to bring something to your attention, well, then you're going to read it. So getting angry doesn't help anybody. Reaching out and encouraging that person to pay attention, and then again, being respectful. I think that's the best social media strategy. It's not, rage gets a lot of views, but it doesn't get a lot of action, in many instances.
I think that's a good reminder, Terry. Jana, do you use social media in your advocacy? Is that a platform you use?
Sometimes. Well, yeah, actually, come to think of it, every Sunday, I do what's called a Sunday selfie with my dad, who is in long-term care. And I actually never put it as advocacy until just now. I never put the link together, but it shows the progression of what he's going through, but it also keeps people in contact to see how he's doing. And through that Sunday selfie, I usually add something, whether I talk about grief or I talk about challenges within, long-term care settings, whatever it is that I'm feeling that day. I always feel that there's a lot can come from vulnerability. So if I can be vulnerable and show that I'm human, especially because I work in the field, I work in the field, I'm a social worker. I really reach deep down into my heart and talk about those things that matter to me. But the Sunday selfie has become actually quite well followed. My mom used to share it on a Care Partners support group on Facebook every Sunday as well. I've had some of her neighbors add me as friends so that they could, follow along and that kind of stuff. And I've had people actually. I was at on a break one day from work and I was standing in line in a coffee shop, and somebody I didn't even know said, "Hey, I saw your Sunday selfie," and I don't make it public, but so my friends are obviously sharing them with other people, and that's okay because it's getting the word out there. And so, yeah, I guess I do use social media in that sense. I always share things such as the webinars from the Alzheimer Society. I talk about, particularly when I was a citizen reviewer with the landmark study, sharing those kinds of things. So yeah, I do. But the Sunday selfies, I think, are the ones that are getting the most attention.
That's fantastic. And I'm sure you'll be sharing our policy priorities when we release them.
Absolutely.
Thanks, Jana. Mario, is social media something you use?
As you most people know, I'm technologically challenged, so I don't do vlogs, I don't do stuff, but I'm a little bit more. I do quite a few podcasts, yeah, nationally and webinars, and also most of the time I engage the students that I mentor at UBC and Simon Fraser to do the posting in Instagram for me, kind of thing. So we always make a point to talk about Mario, a patient partner with dementia. And in a way, it helps them understand that despite 15 years of being diagnosed, I'm still doing well. And then it's basically, they say, look at Mario, he's still out there, out and about doing things that instead of sitting in a rocking chair in his sports or something, kind of thing. So it's always nice to be out there and being involved with public engagements, because be the face of dementia and let people understand that it is an illness that I'm comfortable talking about. And one of the questions earlier is what is the biggest surprise in my advocacy work? If you could allow me to go back and answer that question, is uh, what surprised me most is some people would approach me and say thank you for having the courage to talk about about the dementia, because people don't want to talk about it, and sometimes their voices break and they say, my mom had dementia, my grandfather had it, and now I think I may have it. And sometimes they openly sort of be in that kind of mood wherein they really do not want to talk about it, but they share their experience with dementia. And to me, it's like 8 degrees of separation. Somewhere, somehow, there will be a person touched with dementia in the community. Thank you.
Yeah, it's a ripple effect. And as the population ages, more and more of us are affected by dementia in some way, shape, or form. And that's often the case with the MLAs I know that I speak to. There are lots of them who are affected by dementia in some way, whether that's a parent or grandparent or a spouse. And so I think that's also something that's important for us to keep in the back of our mind, that MLAs and political candidates aren't shielded from these health issues that the rest of the community faces. And sometimes if I'm trying to get to know somebody at an event, that's one of the questions I'll use. I'll say, are you impacted by dementia in your family? And it can be a great conversation opener.
Can I add some last comment on what Terry said earlier when he said, "Oh, when they're meeting, they're talking about issues," and I think that if enough people talk about dementia to their MLAs or the would-be candidates, they would say, most of them in their meeting would say, "Okay, what are the buzzwords from the community?" And if enough of us saying dementia, 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 maybe they say, a lot of people are talking about dementia. Let's hear it and see what we can do about it. Thank you.
Thank you, Mario. So, Terry, do you have any other sort of tips and tricks for our audience today, knowing that you're somebody who, now does this for a living, connects with MLAs for a living, but also has this background of being on the other side of things. Anything we
Yeah.
haven't touched on?
Yeah, it is different being on, either side of the advocacy discussion, being lobbied, if you like, by people as an MLA or a minister, versus doing the lobbying, which I do now, trying to increase the services available for, vulnerable older British Columbians. And I think a lot of things we've talked about are very key. The relationship, going in with an open mind and that sense of respect and knowing that, as Jana said earlier, you're not going to change the world overnight, and so you have to recognize the limitations of the person that you're dealing with. As Minister of Health, you would think, wow, well, he could do anything like to make this better. But the system is not that responsive. It really is not. It is a very huge, large, bureaucratic, slow-moving system. And to call it a system is a bit of a compliment, actually. It doesn't really work as a system in many cases. So you have to understand the limitations of that person's ability to change things around. That doesn't mean that you don't want to continue to advocate, because small changes over time make a difference, and that's how we have always made differences. Is just keep pushing and pushing and pushing, and then sometimes you'll find that you're pushing on a more open door than other times, because for whatever reason it just seems to fit into other things that are going on at the time. So don't be frustrated. Go in there with an open mind, an open heart, and a sense of humor. Like, it's very serious to you what you're dealing with, and sometimes it's overwhelmingly serious, and not to make light of it at all, but you want to connect on a human level with someone. So if you go in there and are demanding or frustrated by the answers you're getting, you won't really be successful in your advocacy. Go in there, recognize that you're developing that relationship slowly over time, and that at other times it'll seem like, wow, things are happening much faster. You'll get some success, but it won't happen immediately, and it may take a few attempts to really get to where you think you're having some success. But don't give up. And anytime that you can supply more information to the MLA, go ahead, because they can take that to their colleagues and or to the minister and ask about it. I mean, the demographics of our country are, so overwhelming that everyone running for public office should understand. But you'd be surprised. Many people just, it hasn't really gotten through to them that baby boomers like moi, 15 years from now there's a whole bunch of us, and the whole bunch of us are going to need support. And if we don't think about it now, knowing that these things take a lot of time to improve, we're going to be in really terrible shape 15 years from now, and it'll be our kids that have to deal with this. So it's really our responsibility to try to make the system better now. So slowly over time, it is better in 15 years.
Sometimes it feels like there's a lot of work ahead of us, and that our voices are really important right now. So we've talked a lot about sort of the places that you've all been successful in your advocacy. What are some challenges you've faced? And maybe I'll start with you, Jana.
I think some of the challenges is it's kind of been on my end, really, is because it is so complex. And what I would like to see the change is being able to pinpoint what my priorities are, so that I can go in there with the proper information to make it a worthwhile visit, right? With my MLA. Because every single aspect of my life has been impacted, and not just in small ways. So that is I think that is the biggest challenge I've had. I haven't really, I've been very fortunate where on the receiving end, like I've been met with, respect, with compassion, with empathy. And a lot of people aren't, but in my case, I have been. So I do put those challenges on myself. It is really kind of refining what are my priorities, what are the solutions that I see going forward, and how can I support policymakers and MLAs, anybody in the community in helping create that change.
Thanks, Jana. What about you, Mario? Any challenges?
I work with people that do research in long-term care facilities, and some of their interesting findings is that most of the services in long-term care home are not really as they're not very focused on people living with dementia, people in transgender LGBT communities, and people who are in the and because of the multi-ethnicity of our population, there are very limited access to those kind of services in for people with dementia in long-term care home. And I think more and more researchers are looking at how do we make them friendlier in terms of the food that they eat, the environment in in the long-term care home, and because most of them are geared towards specific North American population, we need to look at how do we make them friendlier for people with diverse cultural background. Thank you.
So what I'm hearing, Mario, is that when we talk about advocacy for people living with dementia, it's not just advocacy, for people living with dementia. There are a lot of distinct needs depending on a lot of different factors.
Yes. Thank you.
And Jana, I know that that's sort of an important part of the work that you do as an advocate as well, to bring attention to the specific needs of Indigenous peoples.
Yes.
Absolutely. Yeah. And Mario did bring up, a really big point there is, in finding, looking at intergenerational trauma and the impacts of residential school systems on responsive behaviors for those living with dementia, that one kind of hit me in the face with my own experience with my dad as he progressed, and I didn't realize there was such trauma in his life. Looking for research even, and Mario pointed that out about the researchers, going in and stuff that were specific to my nation. I felt very alone, and it was really hard to find supports. So, and that's where, being a dementia advocate, I've started to talk about it, and I see that I know it's not just me, it takes a whole village country of people to talk about these things, but I'm seeing a huge increase in the importance of those culturally specific interventions, supports, everything. Even talking about traditional medicines and treatments, and it's language. Language is a big one. We're not seeing a diverse language, in our long-term care settings specifically. When I think about my dad, and some of those languages are dying really quick, and so it's important to honor that person and look at that research. And so, yeah, Mario, thank you for bringing that up, because it is huge. And research is starting to really look at how those diverse cultures are impacted, specific to their own needs and what's happening, in the trajectory. Yeah.
Jana, if I
Yes.
share something with you that happened this morning, that's why I almost forgot about this meeting. We received a small grant from, I can't remember which one it is, but thank you, whoever you are. But what it is you talk about cultural healing, and we were and I work as a volunteer at a homeless shelter downtown, and the grant that we received was about the indigenous group having a a healing garden, and I was fortunate enough to be consulted on how do they go about building this garden. And I think that is very important. Create a place, hear the needs of these people, and it's very important for us to tell our MLAs, hey, there is a need for these things. There's a need to introduce a bannock or some other food that tradition that can be served in the cafeteria. And you'll be glad to hear that every day we serve bannock because in our cafeteria, because there's always a need for those kind of things as an option for them instead of pancake or whatever. So the healing garden, I think, is a very good response for them to do this kind of supporting community initiatives, and also even this nature walk in Stanley Park for our indigenous group. And we're very fortunate enough through the help of some of our policymakers to give some funding to that kind of initiative. Thank you.
Thanks,
Thanks,
Marion, bringing
Mario.
your, sorry, go
Yeah.
ahead,
No,
Jenna.
I was just going to say thank you for sharing that. That just warms my heart. Thank you for all that work in consulting with that.
And letting your MLA know about that,
Mhm.
so that, you know, he can understand whatever that organization was, probably, you know, funded through taxpayer dollars, that's a worthwhile thing, that it made a positive impact. So he's more likely going to, he or she's more likely to be going to support that organization or similar organizations, because they're hearing about that positive impact that it's made directly from you. So as an advocate, telling those really positive stories really gets those potential MLAs behind you, because they want to see what works and what impact it has.
And Terry, my take home for what you just said is, after this meeting, I'll send a letter to the Speaker of the House, who is who is a constituency office right where I am, and invite him to take a look at the garden that we just created for the community, and let them know that, hey, these kind of things impacts and has such great impact to the community. Thank you.
Lovely example. Thanks, Mario. So I see that Marilyn is writing here that she's planning to meet with her MLA to talk about the lack of space for people living with dementia in long-term care. So that's great, Marilyn. I'm so pleased to hear that you're going to be doing that. Please do circle back to us as staff and let us know how that went and what you think. Jana, Mario, Terry, are there any questions you wish I had asked you, which I didn't?
You all ask almost of the things that I have in mind, especially how do we engage politicians, policymakers, and it is very important for them to understand and hear the community about our concerns, because we are the hidden people with hidden disabilities, and sometimes they most of the time they say, oh, you do not look like you have dementia. And sometimes it is very important to them that, yes, we have some illnesses, and yeah, yes, we are in your neighborhood. Yes, we are in your community. And yes, if you ask me, I might need help, but ask me first, kind of thing.
Thanks, Mario. Jana, Terry, anything that you wish that I had asked you that I maybe didn't?
Rebecca, we used to work together, so I know you were trained very, very well to ask all the right questions.
You got it, Terry.
I haven't worked with you before, Rebecca, but I think you did well in asking some well-rounded questions, and we looked at a whole scope of things, dementia related with advocacy. Thank you.
We covered so much ground, and Erlinda's putting in the chat pod here that a letter about a concern to an MLA is more effective with real people's signatures and addresses and phone numbers or email addresses. Yes, absolutely, that's the case. Great to point out. I'm hoping that after the session today with our fantastic panelists, thank you again so much for participating. You're all interested in learning a little bit more about how you can get involved and how you can further your advocacy journey, whether that's in a little way, a little step, or a big thing that you're planning to do. And so you can learn more about engagement opportunities on our website. And you can share your stories in many different ways, including on our advisory groups. And so if you're interested in learning more about advocacy or learning about getting involved in an advisory group, please email us at advocacy@alzheimerbc.org. And as I've mentioned a few times throughout today's session here, we will be launching our pre-election campaign early in June. We'll make sure that you have information about that as soon as it's available. Okay, so we have the email address for our website up on the slide here, or again, that email that you can reach out to. If you do have questions about self-advocacy, so changes that you're looking to make for somebody you're supporting or for yourself, please do reach out to the First Link Dementia Helpline. They're available to support you Monday to Friday, 9 a.m. to 8 p.m. So that's another resource that's available to you. So I will just thank you all for taking a little bit of time out of your day to learn about advocacy and how you can share your voice to make system change across the province for people affected by dementia.